I've spearheaded an effort through the Alliance Cooperative Group in the Myeloma Committee looking at the combination of pomalidomide, dexamethasone, and the oral proteasome inhibitor Ixazomib for patients with double refractory multiple myeloma. So the way that this study was designed, we initially had a phase 1 portion, and this will be followed by a randomized phase 2 study. And at this ASH meeting, I presented the phase 1 results of our trial. So basically, patients were allowed on study if they had received at least 2 prior lines of therapy. All patients had to have lenalidomide refractory disease, and all patients had to be refractory to either bortezomib or carfilzomib. Importantly, the side effect profile thus far has been very encouraging. The majority of side effects that we've seen up to this point are hematologic in nature, which is not unexpected given the fact that this is a pomalidomide-based platform. So we do see neutropenia with this, we do see thrombocytopenia as well, and some grade 3 and 4, not a lot of grade 4, but the important thing is that it's manageable in the vast majority of circumstances, and we've not seen any problems with clinically significant bleeding, and we've also not seen much in the way of severe infection-related toxicity. The important thing is that the non-hematologic toxicity is actually quite favorable. So the side effects are what you would expect to see with pomalidomide, with dexamethasone and Ixazomib, but the majority of them are grade 1 and 2 in severity. So overall, it's been a well-tolerated regimen up to this point. We've completed enrollment into dose level 3, so we know a 4 milligram dose of pomalidomide in combination with a 3 milligram dose of Ixazomib is safe. And we're about to complete dose level 4, in which both drugs are being administered at 4 milligrams. Once we've finished this last dose cohort, we will be moving on to a randomized study, as I mentioned before. Importantly, the activity of this regimen appears quite promising. So the overall response rate for the first 20 evaluable patients is 55%. And we've also seen durability of responses even in patients in the earlier dose cohorts.